Vanessa, thank you. Breastfeeding is a natural part of a baby and a mother's life, and doctors say both benefit from it. But with coronavirus pandemic in full swing, many mothers are wondering if it's still safe, especially if the mom has the virus. In tonight's Wear the Gown, Eyewitness News reporter Jeremy Baker finds out what new mothers need to know.
Physicians and World Health bodies say breastfeeding should be done even if a mother has coronavirus because the benefits outweigh the risks and the risk of transmission is extremely low. But there are a few things a mother should keep in mind while doing so.
And our overall message is always that moms who are breastfeeding should continue to breastfeed throughout an illness, whether it's her own or her baby's, because of the protection that it provides to baby.
Kate Mclaughlin is a lactation consultant with University Health System. She says mothers should treat coronavirus like the flu when breastfeeding.
We do talk to moms who are diagnosed with the flu to just use some precautions, like ones that we're all becoming very familiar with now: hand washing, wearing a mask when you're breastfeeding in order to prevent transmission to baby.
And one more added step.
The CDC guidelines now include also washing the chest before breastfeeding the baby, just in case. We know it's respiratory droplets, right? But if some of those respiratory droplets have gotten on the chest, it would be probably the safest thing to do to mask, wash hands, wash chest, and then breastfeed baby.
Some of the benefits of breastfeeding include providing breast milk in real time, which programs the mother to create more milk. Studies have shown breastfeeding can make children smarter. Breastfeeding may reduce disease risk, and breast milk contains important life-saving antibodies.
If the mom has encountered an illness, a virus, a bacterial infection, something out in the world, that she's then producing antibodies to that illness and then providing those antibodies to the baby, which then protects the baby.
Mclaughlin also says spending that close time with the baby and the skin-to-skin contact is necessary to help create that mother-child bond. Jeremy Baker, KENS 5 Eyewitness News.
For more information about family health, call 210-358-3045. You can also find the rest of the Wear the Gown stories. Just go to wearthegown.com.